Good evening. I'd like to welcome you all to Lambros Real Estate ERA, and I'd just like to give special thanks to Lambros Real Estate ERA for allowing us to use this wonderful gathering room here. It's a great facility. My name is Mary Louise Zapp-Knapp from Lambros Real Estate and ERA, and I got together with Michelle Kuntz from Investment Protection Solutions. We were at a couple of presentations at the Senior Center earlier, I guess about a year and a half ago, and I had gathered some experts to provide information to the Senior Center, and we decided that there is so many resources here locally, here in Missoula and the state of Montana for our seniors, and the information needs to get out there, that we came together and decided to put together a series of seminars. And this is the second seminar in a series of 5. This one is Aging in the Comfort of Your Home, and I'd like to introduce Michelle Kuntz, who will then introduce our guest speakers.
I need this, but I'm Michelle Kuntz, and thank you so much for attending tonight. I think this is wonderful. I hope that you will really gain some knowledge from this, and if we can improve anything, if there's other topics that you'd like to hear, please let us know, because this could be an ongoing type of thing where we can share with the public. Kathy, I met her better half, significant other, through a workshop that we did last spring, learning how to do websites. And John started talking about what she was doing, and Aging at Home DVD came up, and my mind just goes, ka-ching, here we go. I need to know this guy, I need to know this wonderful lady. So I looked and reviewed her website, talked to her about the information that she had, and wanted to incorporate her as part of this program. I know she has some really helpful tips for us, and I look forward to her presentation. So if you will please help me welcome Kathy Farrell from Aging at Home DVD.
Welcome. I'm glad to be here with you tonight. I'm a registered nurse, and I've been a nurse for many years. Let's just say before Medicare. In the early days as a nurse, I can remember when patients used to smoke in their rooms in hospitals. So that's a very long time ago. But I'm happy to be here with you tonight. The past 25 years, I've practiced both as a clinician and a manager in the area of home care, both in the state of Arizona as well as here in the state of Montana. And I always loved home care for 2 major reasons. Very early, I learned that there was a great humanistic approach which appeals to me. And secondly, there was a huge umbrella where as a nurse you could really practice prevention, and that also appeals to me. So about several years ago I retired, and then I began to think, well, I probably have a little more to offer. And so what I did was I brought together all my knowledge, all my experience, and it has culminated into what is now known as Aging at Home. So I want to welcome you, and I want to provide you with some information that I think is really key. As I began to research what was available for education for elders, their families, their caregivers, I found that there was a lot of fragmentation, but I really didn't see anything that was folded in together that would give people practical information about aging at home. We know that 86% of our seniors want to age at home, and their greatest fear is the loss of independence. And so in looking at my experience both as a clinician as well as a manager in home care, I began to put together some information, some particular problems that we began to see in home care over and over and over again. So I thought, well, what would it look like if we could provide education and maybe begin to look at some prevention? We all know that healthcare is expensive. We know that elders want to age in their home, and their greatest fear is loss of independence. So what would it look like if we could provide education that really made a difference in the area of prevention? So what I did was I began to understand that I wanted to create a series to educate seniors, their families, and caregivers. Very often, elders are in their home, they have families that are supporting them, they also may have caregivers, private caregivers in the home, and so it really needs to be a unified approach to providing care for elders in their home. Elder education, I found, is that when it's applied to life circumstances, whatever those circumstances are, that we can really see positive change. And aging at home means aging where you are. If you're in a residential home, you might be in an apartment. It could be that you're in an assisted living facility. Wherever that is, that's home. And so it's really important that these concepts and these approaches are applied to wherever it is you are residing. In addition to the information, what I became very familiar with was a certain approach as a clinician, and I used to really teach my nurses the same thing. This is what you got to do when you get to the home. And that's where I developed these 5 action steps, so that there's a system, there's an approach that we can use to each of these problems. And I just found that when clients or families or caregivers were using these approaches, they got better results. Elders were healthier, they were happier, they were more stable in their homes, so they could be in their home longer. And that's really what appeals to elders. And this approach I used in, field tested in hundreds of homes. So I know that it works. The 5 problems we used to see in home care, and home care is different than hospital care. But usually home care is administered under the benefit of Medicare. But the problems that we would see over and over again were mismanagement of medications, unsafe conditions in the home, poor nutrition, poor hydration, and then I coined the last one myself. I call it the big questions. It really has to do with planning, how to plan to age in the home. We had 2 speakers last week that were fabulous. One was Renee from Missoula Aging Services, and she provided a great deal of information in terms of Medicare and planning. John McCrae was here. He talked at length about elder abuse and how to protect yourself from fraud. And the big questions includes a lot of that information. So if we take a look next at the 5 action steps, this is an area where I feel the series has the greatest impact. And I want to tell you what the 5 action steps are, and if you could just take a minute and jot these down. Because next I'm actually going to show you how to use these with respect to safe management of medications. So the 5 action steps are, the first thing is to get organized. The second step is to gain awareness. The third step is to gain assistance. Gain assistance. The fourth step is personal responsibility. I think we need to shed some more light on aging, and that is for elders to take more responsibility. One of the things that I learned early as a home care clinician is that all the stereotypes that I thought about our aging population were totally wrong. You know, I somewhat learned that they're helpless, they're foolish, they're dependent, they don't know what to do. I found that not to be true. What I really found to be true is that they wanted to exercise personal responsibility, but they didn't have the information, they didn't have the guidance, they didn't have the knowledge to be able to do that. And so I'm a big advocate of elders taking personal responsibility. So that is step 4. And then the 5th step is to enjoy your life. Because once you get all of this out of the way, it kind of frees you up. Not to worry, not to fret, not to be concerned. So let's go back to, let's see if I can go back, if I can see it. Medications, safety, nutrition, hydration, and the big questions. Now, each of the DVDs are about 45 minutes in length, so realize that I'm here for half an hour, so if I feel like we're condensing it, it's because we are. How many of you take medications? Okay. Most elders take 5 or more medications a day. It's not uncommon to go into someone's home after they've been discharged from the hospital and they're taking 10 medications. So it becomes very confusing. It becomes very disorganized. The idea with medications is that you want to be sure that you have a safe program. You want to be sure that the medications that you're taking, that you're safely administering them to yourself, or that your caregiver is providing them, or your family to you, so that you can receive them safely. 1 out of 5 hospital admissions is directly related to mismanagement of medications. So that means on a national scale, that's equivalent to billions of dollars. Not to mention the human toll it takes when someone is rushed to an emergency room because they're having a side effect or they're not gaining the benefit, the health benefit of taking their medications correctly. So the first part of your handout, what I've provided for you is a sample of a medication list. And if you need more copies, you can go to the website. And on the resource page, you can click on medication lists and download as many as you need. If you want to copy some and give them to your friends, that's fine. But on the resource page, there's a lot of additional information so that you can actually go and obtain this information for yourself. Let's go back to the 5 action steps. The first step with medications is getting organized, and there isn't a better way to be organized than to begin to write down your medications. At the top of the medication list, there is a place for your name. Don't put your Medicare number on here. There's a place for your date of birth, your next of kin, your phone number, any recent immunizations. Maybe you've had the flu shot or the pneumonia shot. It's important that those are up to date. Your primary physician, your primary physician's phone number, your pharmacy with the phone number. And then there's a list and a place for your prescribed medications. Those are the medications that your physician prescribes for you. So you should be writing in your medication, what the prescription is, the name of the prescription, the dosage, any special considerations. And sometimes people say to me, well, what do you mean about that? What is that? Well, medications sometimes should be taken with food. Maybe they should be taken on an empty stomach. Some medications cannot be mixed with certain herbal products, for example. So any special considerations that those medications have, you need to write them down. And this is how you gain awareness. This is how you begin to understand, well, what is this medicine for? Why am I taking it? What color is the pill? Is it blue? Is it pink? Why am I taking this, and what is this supposed to do for me? How am I to benefit from this medication? And so you also write down any side effects. Now, I know sometimes when you receive prescriptions at the pharmacy, they'll give you an insert with the prescription, and the print is so small I can never read it. But in addition to that, it becomes very confusing. So generally when a pharmacist dispenses medication that the physician has prescribed, the pharmacist will give you the major side effects, whether that's nausea, might be dizziness, it might be a rash, maybe you need to be aware of disorientation, whatever it might be. Write the side effects down so that you understand what to do and when to call your physician if you're experiencing a side effect from that medication. This is so critical. More and more people are coming to understand that they really need a medication list. They need to write these things down and have a record of it. So after you've listed all your prescriptions, then the next thing to do is what over-the-counter medications are you taking? Are you taking Aleve? Are you taking aspirin, ibuprofen, whatever else you might be taking? Sometimes over-the-counter drugs interact with your prescribed medications and they don't always have a good effect. You don't always benefit. So it's important to know what medications you take over-the-counter on a regular basis. And your physician should know this. Has your physician ever discussed this with you? Anyone?
Mine does. Always ask me to take it.
Do you have a medication list?
I have a list of the ones that I take daily.
Good. It's good that your physician asks you about that. That's not always everyone's experience.
I go over it every time I go in, and I've been in there like 3 times in the last 2 months, which is nice.
It's not only nice, it's very good practice. It's essential that your physician understands what it is you're taking. The other thing is supplements, any type of vitamins that maybe you're taking. Not herbal products, but vitamins. A lot of elders take vitamin D, some take B12 supplements. So it's important to write down the supplements as well. Very often supplements are prescribed by the physician, but because there is so much health information out there now, sometimes people just take the incentive and just take the products themselves. And then herbal products, any type of herbal products, things like St. John's wort, some people take garlic, some people take turmeric, whatever that might be. And so you need to also list herbal products. So we're getting organized, we're gaining awareness. The other thing is gaining assistance. If in fact you have a medication list or you're trying to do a medication list and you can't do it for whatever reason, then I really advise people to get some help. Ask for help. Someone in your family can help you, your physician can help you, maybe you have a caregiver that could help you, and certainly your pharmacist can help you. I always encourage everyone to make friends with their pharmacist so you can pick up the phone. If you have a question, they can answer that for you. So those are a lot of different ways that you can really gain assistance. Personal responsibility is really taking the step to create a medication list. I always encourage I always encourage elders to take that medication list once it's completed. Make sure you take it to every medical appointment. You know, your physician, your dentist. If you go to the ophthalmologist, make sure you have a medication list with you. You need to treat it as seriously as you do your Medicare card and have a record with you. Having worked in emergency rooms and having people, you know, arrive in an emergency room and not having any history, it takes a good deal of time to try to sort out what's going on with that person. So it's to your benefit to have this as a piece of your health record with you. The other thing is that I always encourage people to keep 2 copies. One so that it goes with you to the physician's office or your medical appointments. And the second one is to have a posting in your home. In the event of a medical emergency, it's so easy to just grab a copy. And then, you know, the ambulance attendant could take it with them to the hospital or to the emergency room. So it protects you, it provides you more safety. There is, you know, this is a part of your medical record that's really important to have. Anyone ever had an experience where you had side effects from medications but you didn't know what was going on? Would you be willing to tell us about that?
Yeah, I took a medication when hard to explain it, kind of turned into jelly almost. And it was the year of all the snow, and I was out at a house out on the logging road, and there was an avalanche, so we couldn't get out of the house. And I didn't know what to do. I mean, it was the weirdest. It was really weird, but my eyes just looked like it was. I didn't know what was going to happen.
And did you have any anticipation that maybe that could happen to you when you started taking those eye drops?
Not at all. Not at all.
Okay, that drives home the point. So get organized, gain awareness, gain assistance. Don't be afraid to ask for help. This can be really complicated. Don't be embarrassed about it. It's your body, it's your health. You need to ask for help, ask for help. Take personal responsibility. If you happen to have a physician who doesn't ask for the medication list, maybe you could provide one and ask them about it. This is my medication list. Is there anything about this? What I always encourage clients to do is, especially with side effects, ask your physician what side effects are reportable. When does that physician want you to call them? Based on what symptoms do they want to hear from you? So it's just a way of cooperating with your health and the managing of your health care. And then enjoy your life. And sometimes people say, well, you know, you just ruined my life. You just ruined my life, is right. And I maintain that if you really understand about this and you organize it and you're doing everything you can to safely manage your medications, you are going to worry less, not more. You're going to be knowledgeable in the medications you're taking. You're going to know when you need to renew your prescription. You're going to understand about side effects. You're going to have better communication with your physician. So it all goes together. Take responsibility and then enjoy your life. There are many, many, many benefits from medications as far as management of your diseases or improving your health, sometimes minimizing symptoms. So it's a good thing. It's not a bad thing if you're taking medications, particularly if they're helping you.
I think it's important that you carry a list of allergies, medication allergies. I have about 5, and I have a list in my wallet all the time. I can't take it. I have no reaction. I don't think a lot of people think about that either.
Right, they don't list their medications, allergies, and they don't list environmental allergies. Sometimes patients or people are allergic to things like iodine or adhesive tape, or next thing you know, you're blistered. It's just, so you're absolutely right. That's a very good point. Okay. Safety. I gave you, I provided for you a handout. Whoa, way over time. I provided you with a handout with respect to safety. And, you know, loss of function sometimes means that you can't always remain in your home. And the thing about safety to keep in mind is that sometimes it's such an easy fix to improve the environment, the safety, the home environment. It's such an easy fix. I won't have time to go over this whole list with you, but what I would encourage you to do is to, if you haven't done this in your home, I want you to do your own home inspection. I want you to go home, I want you to read through each of these items and begin to think about whether or not you need to make some changes in your home so that the home is safer. Is the home cluttered? We find that many elders wind up in an emergency room based on a fall. Maybe they have subsequent injuries, when really the correction in the environment would have prevented that injury. And so elders are more at risk for falls, they're more at risk for injury, and the whole idea is to drive prevention with respect to safety. And I might add that most falls, is the home uncluttered, the hallways well lit. I always mention that because most falls occur in the hallway. In the hallway, in the bedroom, in the bathroom. That's where most falls occur. You know, it's very unfortunate if someone falls and it's in the hallway, and it's unfortunate with any fall. Is there a phone nearby? You know, I really encourage you to gain assistance with respect to a phone. If you have a cell phone, the next of kin or emergency number is programmed into the phone, because it's really important that you can gain access, you can get help in the event that you do have a fall. Sometimes it's a matter of people falling, they're not injured, but they just can't get themselves up. They can't lift themselves up. So it's good to have a phone nearby where you can actually make a call and know that assistance is on the way. There's 3 pages to that safety handout, and I realize that it's quite lengthy, but I think it's also comprehensive. It's what is recommended by the Centers for Disease Control. If you go to the website again on the resource page, you'll find a lot of other resources with respect to keeping the home safe. You know, the big thing with safety is, and preventing falls also, is having strength and endurance and flexibility. So I always encourage elders to exercise, and exercise as much as you can. If that means sitting in a chair and moving your legs, or, you know, I used to have clients that I'd give them a can of soup, and they'd just raise it up like a weight. They'd begin to strengthen their arms, and they'd feel stronger. So that's really important, to have strength and flexibility. The next topic has to do with nutrition and hydration. And sometimes people will say to me, well, I eat, I drink tea. Nutrition is really important. We're just beginning to really understand the physiology of nutrition in aging. And fortunately, there's a lot of research now that's being done to help educate us what nutritional approaches are best in our aging population. I gave you a handout for the food pyramid. I was pretty excited about this. Not everybody would get excited about it, but I did. And the reason is, it's brand new research. This is just published within the past 2 or 3 years from Tufts University School of Nutrition. And they finalized this so that we have a better understanding as we age about what is important with respect to diet intake. I know that a lot of people are on special diets. This is really a regular diet. The thing that is absolutely essential is your water intake. We've never had really any information about how important fluid intake is, and that's why I also present a DVD that talks about hydration and how important that is for elders. If you're taking medications and you're not drinking enough fluid, you can really become toxic. And so it's really important to drink between 7 and 8 glasses a day, and you can put yourself on a hydration program and easily achieve that. It's not difficult. You know, as we age, physiologically we have changes. And about at the age of 60, and it increases through the age of 80, we have really a decreased sense of thirst. You know, normally when you work out hard and get thirsty, you have a drink. Well, as we start to age, that's suppressed. And so many times when I'd see elders in the home, they'd say, "Oh, I don't drink any water, I'm never thirsty." You're right, you don't. Because that's suppressed, that thirst is suppressed. So even though you're not necessarily thirsty, it's important to drink the fluid. This pyramid breaks out the different types of food groups. It's kind of old school, the food pyramid, but it works pretty well because it shows you a number of servings. I encourage everyone to try to eat vegetables and fruit that are in season, but the fruit and vegetable groups can be canned or frozen or fresh, each of those groups. Milk, yogurt, cheese, and then meat, poultry, fish, and then using fats and oils sparingly. Olive oil is a good product. And at the top of the pyramid, you'll notice that there are supplements because very often elders take calcium and vitamin D and B12. Very often they're prescribed by physicians, but it should be incorporated into a nutritional program. And this too is an area where we can actually go through, and I go through in the DVD series, the 5 action steps, how to get organized, you know, gain awareness, get help, that type of thing. So all of the DVDs include the 5 action steps because I just have found that it works so well. The other thing that I want to mention about the food groups is that if you're on a special diet, you really need to need to be in touch with your physician about what your special diet is. If the physician can't answer your questions, then I always encourage people to ask the physician who in their office could answer the questions so that they can help you with any type of special diet you might have. The big questions. This is the 5th in the series, and I talk at length about legal and financial issues. We covered a lot of that last week with Renee and Bob McCrae. Elder abuse, not only physical abuse, but financial exploitation, sexual abuse, verbal abuse, driving safety, whether or not a person is safe to drive and what to do if you're not. How do you know that you are or you are not safe, and what to do if you're not? So I spent a lot of time on that topic. And then I also talk about in-home care because, you know, I managed a private duty company in both Arizona and Montana, and I'm quite familiar with in-home care. What do you do? How do you know when you need in-home care? How do you evaluate that? You know, the average cost of in-home care is, in the United States, is about $18 an hour. Can you afford it? If you can't afford it, then where else are you going to get help? So I talk at length about how to find a good company, what do you look for, what do you do if there are problems, and then I also discuss the issue of end-of-life care, living will, hospices, how to look for a hospice in the community. On the website and on the resource page, there's a national association that will rate and rank home health agencies as well as hospices. So if you're interested in trying to find out who's at the top 50 rather than the bottom 50, you can go to that resource page and really determine who's there and who's the best, who's in the upper 50%. I've kind of run a little over on my time, and I apologize to the next speaker for that. But I do want to say a few more things. I want to thank you for being here. I think that it's really important. I feel like you exercise personal responsibility by being here, wanting more information. I don't think it's just a courtesy to Michelle and Mary Louise. I think it's really an effort to, and I would encourage you to continue to do this. I think that it's really important that we shine the light on the aging process and really talk about it. We have so much to learn from one another, and I certainly learn a lot all the time, and I still continue to learn. So I hope this was beneficial. What I encourage you to do is to visit the website. I do a blog with Kathy's Corner, and I talk a little bit of this and a little bit of that with different topics as I start to see that it's really kind of pressing as issues in the industry, and so I try to do a summary to give people helpful hands and helpful tips. You know, some people say to me, well, Kathy, why didn't you just write a book? I said, well, you know, I'm not very good at writing, number one, and number two, I think that the DVDs serve as a really good instructional tool. People can use them in their home in privacy. They can take their time with them. They can take notes. They can go back and watch it over again. So it really helps to reinforce the message with medications, safety, nutrition, hydration, and the big questions. I did bring some DVDs tonight, and we've discounted them for this group. If you're interested, you're certainly welcome to take a look at those. And I want to thank you so much for this time, and I'm so glad to see all of you here, and I hope that it helps you. And use those medication lists and get after that safety checklist in your home.
Thank you so much, Kathy.
You're welcome.
Great. Good information. Denise Kruger is with Homestead, and should be a nice complement to what Kathy was talking about, because Homestead is an agency that can provide everything we've just mentioned as far as assistance, follow-up, safety checks, keeping up the list on medications. So Denise will share with us what her company does, and we'll learn just a little bit more what's available in the community as a resource. It's a wonderful company. So please share with me in welcoming Denise Kruger from Homestead.
Okay, well, thank you, everybody. I'm really happy to be here tonight. I think it's very important, and I think Kathy had a lot of great tips and pointers, and she's exactly right that 86% of seniors want to age in place or age at home. And I think an important key really to focus on is that does mean wherever it is they're living. So when you say at home, it doesn't mean, like Kathy stated, that it has to be in their own home where they raised their family, and it could be in a facility, whether that be independent living or assisted living. So what I'm going to do tonight is just hand out a booklet that I'll walk through with you, and my card in case you guys have any questions that you think of after tonight. I want to please encourage you to give a call anytime. There you go. And I'll put one back here for you, Mary Louise, you bet. All right. So, for those of you that aren't familiar with Home Instead Senior Care, we provide in-home non-medical care. And I think a really big question that people have is that, yes, I want to age at home and be in the comfort of my own home, but is that possible? You know, sometimes folks face hurdles and obstacles that may put a bump in the road, and people who are uninformed may just suggest going straight to a skilled nursing facility and take them away from that dream of being able to age in place. And so this booklet is really pretty comprehensive in just the few pages that it offers, and it talks about in-home care, whether that be medical or non-medical. And at Home Instead, we only do the non-medical component, but we work hand in hand with in-home health care, which provides the medical component of that. And so, you know, this covers everything that I'm going to talk about, just kind of a basic overview of what in-home non-medical care is, signs that maybe you should look for to determine if you maybe need the assistance, and then also things to look at when choosing an agency or an individual to provide the in-home non-medical care. It also talks about a little bit about the home health care, which is the medical component. So I won't cover that tonight because I'm not a specialist, so to speak, in that, but folks at Home Instead Senior Care Incorporated have done research. And while we are locally owned and operated in Missoula, and we serve Missoula and Ravalli counties, there are over 900 franchise offices across the world of Home Instead Senior Care. And we've got standards that we live and breathe by. We strive to be the best, and so hopefully you'll find this information to be helpful. So feel free to go through it or just listen and take it home and look through it at your leisure. So home care, touched already a little bit about the differences between non-medical and home health. Obviously, home health is the component that is covered by Medicare. It offers PT, OT, speech therapy, so physical therapy, occupational therapy, also in-home nursing, skilled nursing. And the non-medical care, when I first started with Home Instead, I thought, well, gosh, I've really thought a lot in the past about the home health component, and I can definitely see a need for that. But it's interesting, I hadn't done a lot of thinking about the non-medical component. And you think, well, shoot, if I'm in my own home and I'm independent and, you know, I can get by, I may need, you know, a therapy or nursing, but what is non-medical care? Well, when you look at home care, it often revolves around the ADLs, or activities of daily living, and also the instrumental activities of daily living, the IADLs. And so these are listed really nicely for you on the first page. And the ADLs are basic activities and functions that are performed on a daily basis, and they're usually done without assistance. So there are 6 of those, and that would be eating, dressing, bathing, toileting, transferring, and continence. The instrumental activities of daily living, the IADLs, on the other hand, are those activities instrumental to our daily routine. So driving, preparing meals, doing housework, shopping, managing finances, managing medication, using the telephone. So we'll go on to the next page. The in-home non-medical care helps a senior remain as independent as possible, focusing on those ADLs and IADLs. And Kathy was exactly right. 86% want to continue living at home. So you're at home, you're independent, you're doing really well, and then maybe something happens. Maybe you have a fall, and you think, oh my goodness, and healthcare professionals are saying, you know, we'd really suggest you go to a skilled nursing facility after your rehabilitation or whatnot. and you think, I'd really love to stay at home. Well, agencies like Home Instead Senior Care can provide the peace of mind for either yourself or for your loved ones and help you stay independent at home by providing such things as medication reminders, assistance with housekeeping or laundry, assistance with transportation. So maybe you have to give up driving and your fear is, oh my gosh, how do I get by living at home when I can't drive anymore and I have to give up the keys? So, caregivers can help you get to the grocery store, to doctor's appointments, or just to go bowling or play bingo. Keep up on activities that you've always loved to do, and you shouldn't have to give those up. We assist with personal care. So if you need help getting dressed, if you need just standby assistance when you're taking a shower, your confidence has gone down a little bit because you've suffered from a fall, you've had, you broke a hip or whatnot, and the recovery time takes longer than you anticipate because you are older. It's a good idea to have somebody in your home and be there just for that peace of mind. And we're talking, it can start minimal. If you need somebody in for just an hour a day to come in and check in, make sure medications are taken, talking about that medication management list, it can get confusing, overwhelming. A lot of pharmacies today offer like DocuDose or blister packs to help manage that medication and make it less confusing. It's pretty surprising how many seniors are on multiple medications and supplements, and how many seniors have loved ones or friends nearby, but those loved ones or friends are obviously involved in other activities throughout their days and in their busy lives, and they can't check in every day and make sure that that senior is on track. And the senior just doesn't feel confident enough to carry on, and that's completely normal. So some signs to look for when you're thinking, is home care for me or for a loved one, would be noticing, looking around the house. Do you notice that bills are piling up or mail? Another aspect of that is that seniors may be able to open their mail and go through it on their own quite well, but this day and age with phone calls that are being placed, scams, junk mail that's received, asking for certain things, oftentimes it's a good idea to have that second eye in place to look for those kinds of things, and so people aren't falling into those traps. Something to look for is reluctance to leave the house. So was the senior once active and involved in the community or with friends, and as they've aged, or maybe their significant other has passed away, they become reluctant to leave. Losing interest in meals. So, Kathy spoke about that a little bit. Nutrition is so important, and what can happen is, for one, we know that appetites decrease, which is normal. You maybe go at an age when you're younger in life and you have 3 square meals a day, and now you're having 2, which is fine. But you have to look and consider the fact that, for one, a lot of folks have some memory, short-term memory loss, and so safety of cooking your meals in the home. And that's where it's great, where Meals on Wheels or whatnot can be a great idea to solve that solution. Or if somebody's living in an independent living facility, then they're having their meals provided for them. Something with the meal preparation and the losing interest in meals, Home Instead and agencies like us can give meal preparation and can make sure that healthy meals, nutritious meals are being consumed, and again, give family members that peace of mind. We have many clients that are receiving Meals on Wheels, and they come, and that's a great service. The food is, prepared and ready to eat, but I've heard anyway that it doesn't come in the most attractive form, and it's just kind of put in that carton and whatnot. Well, what a caregiver could help do is perhaps take that, put it on a nice dish or plate in reasonable portions. Start with half the portions, add a nice fresh side salad, and liven up the meal, and provide companionship while that person is eating to try to stimulate their appetite and make that just more of an enjoyable time. I know when my husband is out of town and I'm cooking for one, or just me and my son, it's not enjoyable. It's gosh, what do you cook for one person? And it becomes more of a headache than, So having a companion, and that's something that people shouldn't be ashamed of. A lot of the time I hear seniors say, well, I'm independent, I don't need this, I don't need anybody, I can get by just fine. And you'll often find that if you're a family member of a senior that's really adamantly, and they're very opposed to receiving care, that after a few visits, again, how irregular or regular that may be, that senior really starts to develop a friendship and enjoy that companionship, and it's really important. You're going to want to look for declining personal hygiene, declining driving skills. These are a couple of factors, and in the back you'll notice a page that has resources. And one of those resources is Talking with Seniors, the 40-70 rule. And that's an idea that Home Instead Senior Care rolled out years ago, and it suggests that if you're 40 and your folks are 70, or if you're 70 and your children are 40, then it's probably time to start talking about some sensitive subjects. One of those could be hygiene. One of those could be, oh my gosh, Dad just reversed into a light pole and yikes, maybe it's time to take the keys away. But how do I bring that up to him without sending him into a defensive tone and making it seem like I'm trying to take away his independence? So I have some 40-70 booklets with me if anyone's interested. Otherwise, you can check out that website, and it offers great tips on that. What more to look for? Scorched pots and pans. This may be a sign of short-term memory loss if pans are staying on the burners for too long. Little tips for you to just kind of keep your eyes open, or if you're living independently and you start to feel like your memory's starting to drift or you're worried about your safety, definitely keep these in mind. Signs of depression, feelings of hopelessness and disparity, fewer visits with family and friends, a change of sleeping patterns, decrease in appetite, even more so. Missed doctor's appointments and social engagements, an unkept house, so changes in housekeeping may just show that the senior is physically tired. And let's face it, after all of the years of keeping up on a house, they deserve nothing more than to be able to enjoy the later years of life and do what they want, and have somebody else come in and handle the cleaning and the laundry. A lot of the times we're contacted because these seniors are living in their homes that they've lived in for ages, and the laundry is in the basement, down those stairs that are so scary to go down. And so it's just not worth it. It's not worth waiting until a crisis occurs before you act on the assistance that's needed. And again, losing track of medications. So those are some signs to look for. I think pretty much on pages 6 and 7, I've touched on when non-medical care is needed: eating, dressing, bathing, toileting, transferring, continence. So maybe sometimes there's just accidents that happen, and it's again nothing to be embarrassed about, but it does happen, and because it is happening doesn't mean that you need to go to a nursing home. Companionship, meal preparation, light housekeeping, medication management, errands, shopping, transportation, hobbies, laundry. So when you really think about what a senior does in their day, or what they used to do and what they still should be doing, there are a number of things. Shoveling the driveway and the sidewalk in the wintertime, just getting out, checking the mail, getting the garbage out, watering the plants, keeping a garden, all of the things that people know and love to do and still should do as they age. The next page, pages 8 and 9, talk about the home health care. So that's more for like what I mentioned, the occupational therapy, speech therapy, wound care, mobility training, pain management, IV therapy and injections. A lot of that may be the pain management and the IV therapy. You know, you can age at home for the entire spectrum of life. So even when you get to the end of life, you're going to have hospice maybe in place, and home health care and non-medical in-home care providers work hand in hand with hospice to keep you comfortable at home in those later days. So that's a good page to read to educate yourself, just, you know, kind of fast and furious on home health care. So I think it's important to know what to look for when you are considering non-medical care. You know, there are agencies like Home Instead that hire caregivers who are screened, trained, bonded, and insured. They're covered with workers' compensation insurance. There are independent contractors with a registry, and then also independent caregivers that don't work for anybody. They're out there on their own. Something that's important to look at is, have the caregivers been trained, and by whom? To what extent? Are all of the caregivers trained? Or maybe do they come to the agency and say, oh, I'm a CNA or I'm a PCA and I've been there, done that. You know, you want to look for an agency that's comprehensive and that really looks at their folks, and they want the services they provide to be uniformed and complete and have that training comprehensive. Have the agency's caregivers pass criminal background checks, driving record checks? Will they be bondable and insurable? That's a big one. So a lot of those independent caregivers, you don't know about that. And also they're not bonded, they're not insured. If they hurt their back in the home, then that could be a big issue because they're not covered with the workers' compensation insurance. Can you check references on the agency? So, you know, it's helpful if you have friends or family that have used non-medical care before. Or, you know, you can do your own research and look on the internet. That's a really great tool, as Kathy was mentioning, to try to see who out there is credible and who offers nice, solid, good, safe care and consistency. Does the agency offer backup or replacement caregivers? You know, you are depending on these caregivers to stay in your home. And so you need an agency that's going to provide some consistency. And if their primary caregiver is sick, what's going to happen? Are you going to be left high and dry and, sorry, Mrs. Smith, you know, just take this as your med reminder today. Hopefully you're taking those meds. Or are they going to have another caregiver that they can send out and care for you? That's a really big one there. How much input will you have in selecting the caregivers? You know, sometimes there are agencies, it's called self-direct, that allow you to have a lot more input. And I don't know, actually, after I've stated that, if I like the way I said that, because agencies that hire and train and match you to caregivers like Home Instead are going to let you have the input. It's just going to take away the hassle and the headache from you. You're not going to have to, you know, interview a number of people and you know, set the schedule and work with that person that you ultimately choose to make the schedule and all of that. What restrictions, if any, apply to the services provided? Is there a minimum in the hours of service? Do you have to have 3 hours a day? Some agencies have a 3-hour minimum or a 4-hour minimum. Some offer a 1-hour drop-in all the way to 24/7 care. And how much flexibility will you have in setting a schedule for services? And that's a big one too, because you want to be able to determine what you need. If you start with a certain amount of services, and you know, a lot of people when they start home care, they don't know what to expect, and they think, gosh, you know, maybe I do need like 5 hours a day, or I just need a meal cooked, so maybe that'll just take an hour. They don't know what to expect. So look for an agency that will provide that flexibility. You know, once you start, you may say, well, gosh, let's try this for a week. And if it's not working like you anticipated and you need to, you know, increase the service, then you can do that. If you need to decrease, you can do that. Maybe you need, you know, 6 one-hour drop-ins a week, Monday, Tuesday, Thursday, Friday, Saturday, Sunday. But on Wednesday, you'd like to have 3 hours of service to touch on laundry and cleaning and more than that medication check-in. You want that flexibility. How much notice does the agency need to begin or cancel service? What is the cost of service including? So again, the minimum hours. Do they do overnights, 24/7 care? You know, you can look at the cost of in-home care and compare it to, say, that of an assisted living facility. And depending on the range of care that one needs, it can be very competitive, or staying in your own home could actually be more affordable. So that's something to consider. Also, look for an agency that'll work with you and your budget and try to stretch the money that you have available, you know, as far as possible. Because with in-home care, primarily it is private pay. Some long-term care insurances do cover it, so that's definitely something to look into, because you know, we see at Home Instead, we see that more and more every day. Seniors that have long-term care insurance policies, they got years and years ago, and they tend to forget about them as they age. They've been paying towards them, but that's a huge benefit there. Does the agency maintain a quality assurance or supervisory program? Are they out there consistently seeing what their caregivers are doing and what kind of service is being given? What is the agency's communication plan to keep families informed? A lot of the time, families have in-home care come into the home so that they can have peace of mind, but they live 2 states away. And so what is in place and provided by that agency to assure the loved ones away that they know what's going on and how their senior loved one is getting by. Do they require a service deposit? Does the home care agency offer the personal care services the patient needs, like assistance with bathing, dressing, toileting, those kinds of things? And are patient special needs, such as language preferences, accommodated? So that's a list where you really want to interview the in-home care agency that you're looking at, or go and contact several. See if they're willing to come out for a no charge, no obligation consultation to meet with you in person and assess your home and assess the safety of your home. Meet with your family members and friends. All really important. It also talks questions to ask home health care providers. So when you're looking for those medical and skilled care services. And then on page 14, wrapping up the book, I came here earlier, but it has the 4070 website. There's also a tremendous amount of other resources on that page. And I think that at Home Instead, we strive to be a resource more than anything. So maybe our services aren't exactly what you're looking for, but we've done a lot of research since Home Instead's been around since 1994, and there are a lot of facts and numbers out there, and we strive to be out there in the community. And I know here locally, I get out and I find out what's available and what's out there, so that if you just need to call us and say, you know what, I don't think I'm ready for in-home care yet, or maybe I am and you're just not sure where to go next, you know, give a call, and we will do our best to answer your questions, direct you to a resource, and point you in the right direction so that you can get all of your questions answered, and most importantly, just age in place wherever it is that you're comfortable. So hopefully you guys find this helpful. I don't know, time-wise, looks like we're about good, but I also want to be able to answer any questions that anyone may have. Yeah, Michelle.
I was just, I have a big concern of mine. I think that your agency and the people who are are also able to spot cases of abuse or where somebody's been scammed because you become familiar with the patient or whatever that you're taking care of. So you can see changes. Have you run across this?
We have, and you know, sometimes the caregiver notices something, or an administrative staff member notices something in a home, and maybe there isn't family to contact and reach out to, and maybe the senior is receiving pretty much round-the-clock care, and they're not coherent or in the right mind to notice, and yeah, so those are things that we look for and have resources out there that we may make a call and state our concern. But I think most importantly is when family members that live out of state or even in the same city and they just aren't able to get there often, you want to look for communication tool or something, and those keen eyes and observations, and know that, you know, that's a huge part. It's just having that in place for the extra set of eyes and ears, and knowing that you're going to be contacted if differences of you know, care or change in condition is noticed.
I have a question.
Yeah.
Do all the agencies like where you see do the background checks, or do you have to specifically ask if they do that?
I would specifically ask, because while I'd like to say that all agencies do, I can't be for certain.
Okay. You would think that would be part of the, do you have to be licensed yourself with that? You have to be licensed.
Well, insured and bonded, non-medical is not licensed in the state of Montana,
Okay.
but insured and bonded.
I had a friend's mother one of her caregivers stole the purse.
Oh,
That was in Helena.
yeah.
They knew exactly who took it.
Mhm.
She took it.
It's a scary thing because
She didn't realize that, you know, she left her pocketbook out.
Yeah.
The person was gone the next day.
Yeah. It's, you know, seniors are so susceptible to having people come in, and because maybe there are rooms in their home that they just, they don't know what's in there anymore, and they haven't been in there for, you know, ages, and somebody could just go in there and take what they see, and it would go unnoticed for a long time. Or it could be something more, you know, like a purse that is absolutely valuable and has information in there that, yeah. So I would ask that question outright if background checks.
Because there are several agencies that do background checks. I mean,
Yeah, and you may want to ask if they do just a statewide background check, or do they do nationwide?
you can have either, I mean, you can ask them to do both, because the agencies that do that will do nationwide or just within the state.
Right, yeah.
I would like to add something to that as well. I know the question isn't directed at me, but I noticed in the end of your booklet, which I think is really important, it mentions the National Private Duty Association. And they've been in existence for maybe 6 or 7 years or less. But they actually are setting standards and quality standards both for agencies as well as employees for those agencies. So the whole standard, the whole level has been raised, whereas 10 years ago that didn't exist. So I think it's important to know that an agency is a member of that organization and is meeting those standards.
Right, absolutely. Yeah. So, well, good. I like Kathy, really appreciate you guys coming out tonight. I think, you know, ditto her comment about how it's you're seeking information and taking the steps now to find out about what's in place and what you can do. Because like I said, it's too often that it occurs with a crisis happens and people are, you know, have their arms up in the air not knowing what to do, and that just turns into a scary situation. And oftentimes results in possibly a senior having to move somewhere into full skilled nursing or something when they ultimately didn't want to and didn't have to. Yeah. So, yeah. Thank you.